Welcome to Health Education, your go-to channel for expert-backed health insights, especially tailored for seniors and their families. Today's video reveals a shocking medical truth that even many doctors aren't openly talking about. As a brain doctor, after years of examining MRIs, studying strokes, and treating hundreds of seniors, I've discovered something deeply alarming. A routine test, commonly done in clinics and hospitals, might be putting you at a much higher risk of stroke, and it could happen overnight. That's right. Something as simple and seemingly harmless as a standard diagnostic test could be silently raising your chances of suffering a life-changing, or even fatal, stroke. It's not just the test itself, but what happens right after that makes it dangerous. Now, before panic sets in, this doesn't mean you should skip all medical tests. Absolutely not. But what it does mean is that informed decisions, smarter timing, and preventative steps are essential. Especially if you're over 55. In this video, I'll break it all down. The science behind strokes in seniors. What this routine test actually does to your body. How your brain responds after the test. And what you can do immediately to protect yourself and your loved ones. So make sure you watch this video till the end, because I promise you, it might just save a life. Let's dive in. A stroke occurs when the blood supply to a part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Within minutes, brain cells begin to die. For seniors, this is one of the most serious and life-altering medical emergencies they can face. The older we get, the more fragile our blood vessels become, and the greater the risk that something small, like a spike in blood pressure or a sudden drop in blood flow, can trigger a cascade of damage in the brain. There are two main types of strokes: ischemic strokes, which are caused by blockages or narrowing of the arteries, and hemorrhagic strokes, which are caused by bleeding in the brain. Ischemic strokes are by far the most common, accounting for nearly 87% of all strokes, especially in people over 60. These blockages are often due to blood clots or a buildup of fatty deposits called plaque. The challenge is that the symptoms can be subtle at first: dizziness, temporary confusion, slurred speech, and if not recognized early, the damage can become permanent or even fatal. Now let's talk about why seniors are at greater risk. As we age, our arteries stiffen, our blood pressure tends to rise, and our ability to regulate circulation decreases. These age-related changes are natural, but they also make it easier for blockages to occur and harder for the body to recover from them. Additionally, many seniors have other health issues like diabetes, high cholesterol, and heart disease, which compound the risk. When these conditions are not managed properly, the chance of a stroke increases significantly. But here's the part most people don't realize: certain medical procedures or tests, routine ones that we trust, can temporarily spike blood pressure, stress the heart, or dislodge plaque from the artery walls. This can set off a chain reaction that leads to a stroke, sometimes within hours. Seniors with already compromised blood vessels or high plaque buildup are especially vulnerable. A simple test that causes a change in blood flow could send a clot straight to the brain. The scary thing is that most of these strokes happen silently. They may not cause full paralysis or obvious symptoms right away. In fact, many seniors experience small, mini-strokes, or transient ischemic attacks, TIAs, without even knowing it. These brief interruptions in blood flow might only last a few minutes, but they are warning signs that a major stroke could be coming soon. What's worse is that many healthcare professionals dismiss these events, especially if the patient doesn't report them clearly or if the symptoms disappear quickly. In the brain, every second counts. Unlike other parts of the body, the brain doesn't heal the same way. When brain cells die, they usually don't regenerate. This means that a small delay in diagnosis, or an overlooked symptom, can have permanent consequences. Memory loss, speech problems, paralysis, personality changes, these are just some of the devastating effects that can result from a stroke. Family members often describe their loved one as never the same after a stroke. Their independence is lost, daily routines are disrupted, and the emotional toll can be overwhelming. Depression and anxiety are also common after strokes, not just because of brain chemistry changes, but also due to the frustration and helplessness that comes with losing basic functions like walking, talking, or writing. Another major factor in stroke risk is dehydration. Seniors often drink less water due to a reduced sense of thirst. This thickens the blood and makes it easier for clots to form. Combine that with a stressful test or a fasting period before a blood draw, and you have a perfect storm. The blood becomes thicker, the vessels are already inflamed or damaged, and a sudden movement or pressure change causes a clot to break loose. It's important to remember that strokes don't only happen in hospitals or during emergencies. Many happen at home, in the middle of the night, or within hours after a medical visit. This delayed onset can make it hard to connect the dots between a routine test and a sudden neurological episode. Doctors may not even ask about recent procedures unless the connection is clearly pointed out. This is where education and awareness become powerful tools. Seniors and their caregivers need to be proactive, not passive. You must ask the right questions. What is the risk of this test for someone my age? Could this procedure affect my circulation or blood pressure? Should I hydrate more before and after? Are there warning signs I should watch for in the next 24 hours? Many strokes are preventable. That's the most heartbreaking part. With the right information and a bit of caution, lives can be saved and disabilities avoided. But the healthcare system is often too fast-paced, and patients are moved through clinics like items on an assembly line. There's little time for personalized advice or in-depth warnings. That's why this video is so important. It's not to scare you, it's to wake you up. Because when you understand how vulnerable the aging brain is, and how easily something as common as a blood pressure cuff or a stress test can throw things off balance, you'll realize that every decision counts. In upcoming sections, we'll break down exactly which tests are risky, how they interact with the vascular system, and what alternatives or precautions you should consider. But before we go there, take a moment to reflect. Do you know someone who had a stroke after a seemingly harmless doctor visit? Did anyone tell them what might have caused it? Were you told about your own risk factors? If the answer is no, you're not alone. And it's time to change that. Because knowledge is the first step to protection. In today's healthcare system, especially for seniors, routine tests are considered the cornerstone of preventive medicine. Doctors order them frequently to catch early warning signs of disease, track chronic conditions, or assess overall health. On paper, these tests sound completely harmless. But in practice, for seniors with already fragile systems, even routine medical procedures can pose hidden risks, especially when it comes to the brain and circulation. These risks often go unnoticed until it's too late. Let's first consider the most common test, the blood pressure check. It's so routine, we don't even think about it. A nurse wraps a cuff around your arm, inflates it tightly, takes the reading, and moves on. But what many people don't know is that for seniors with stiff arteries, the pressure of the cuff can sometimes dislodge plaque buildup in the arteries. This plaque, if it breaks free, can travel to the brain and trigger a stroke. While rare, it becomes more likely in those with a history of high cholesterol, atherosclerosis, or uncontrolled hypertension. And because the blood vessels of older adults are less elastic, they don't respond as smoothly to sudden pressure changes. Another common test is the fasting blood sugar test. Seniors are often told not to eat or drink anything after midnight before a morning blood draw. While this is meant to get accurate glucose readings, the result is a dehydrated and sometimes lightheaded patient arriving at the lab with low blood volume and thickened blood. This thickened blood increases clot risk, and the sudden intake of food or fluids right after the test can cause a sharp change in blood pressure. That sudden shift in vascular dynamics, especially in someone with clogged arteries, can increase the risk of a clot forming or moving toward the brain. Cholesterol tests are also routine and require fasting. But here again, the process is stressful to the body. Seniors who are already managing multiple medications, have irregular eating patterns, or have trouble hydrating may experience dizziness, fatigue, or confusion after the test. These symptoms may seem minor but could be early signs of vascular stress or inadequate blood supply to the brain. Unfortunately, they are often brushed off as normal aging. Let's not forget the stress test. This test is meant to evaluate how the heart functions during physical exertion. It usually involves walking on a treadmill while being monitored, or getting an injection that simulates exercise if the patient can't walk. The goal is to detect hidden heart problems, but pushing the body into a high-stress state can be dangerous for seniors with compromised vascular health. These tests increase heart rate, blood pressure, and adrenaline. If a blood vessel is already narrowed, this pressure surge can rupture plaque or cause a clot to form, increasing the risk of a stroke soon after. CT scans and MRIs with contrast are often done to examine the brain, heart, or blood vessels. But the contrast dye used in these scans can also temporarily affect blood pressure and kidney function. Seniors with poor hydration or kidney issues may not flush out the contrast dye efficiently. This can lead to vascular inflammation and increase the risk of clotting. Some patients feel dizzy, flushed, or disoriented afterward, but these effects are rarely followed up unless severe. Yet they can signal early signs of reduced blood flow to the brain. Another overlooked test is the carotid ultrasound. This test checks for blockages in the neck arteries that supply the brain. Ironically, during this test, the technician applies pressure to the neck with the ultrasound probe. If a plaque is unstable or loosely attached, this pressure, combined with neck movement, might dislodge it. While it's extremely rare for the test to directly cause a stroke, there have been documented cases of transient ischemic attacks occurring shortly afterward, especially in people with significant narrowing of the carotid arteries. Then there are colonoscopies and endoscopies, which are often done under sedation. The prep for these tests involves drinking large volumes of laxative solutions, which can lead to dehydration and electrolyte imbalance. The sedation drugs used can lower blood pressure, and the stress of the procedure may further destabilize fragile blood vessels. Seniors who already have low baseline blood pressure or irregular heartbeat are especially vulnerable. Post-procedure, many patients report dizziness, brain fog, or fatigue, all of which can be early signs of decreased cerebral circulation. Even dental procedures, though not technically medical tests, often involve reclining in a chair, injections, suctioning fluids, and stress. Blood pressure can spike or drop suddenly, especially in nervous patients. Older adults taking blood thinners are at a heightened risk, especially if their clotting function is compromised. A sudden drop in blood pressure during or after a dental procedure has been linked to brief episodes of cerebral hypoperfusion, which in turn could lead to a small, unnoticed stroke. One of the most underdiscussed tests is the tilt table test. Used to evaluate dizziness or fainting, this test moves the patient from lying to standing in a controlled environment while monitoring blood pressure and heart rate. For a healthy young person, this isn't an issue. But in seniors with autonomic dysfunction or postural hypotension, this sudden change can cause fainting, reduced blood flow to the brain, or even trigger a TIA. While meant to be diagnostic, the very act of testing can provoke the very condition it's trying to understand. Even vaccines and injections, which are routine, can sometimes cause brief systemic reactions like fever, rapid heartbeat, or low blood pressure. While these side effects are usually mild, in elderly individuals with narrow arteries and limited blood flow to the brain, the added inflammation or fluid shifts can contribute to stroke risk in the hours or days that follow. Many strokes that occur randomly after a flu shot or COVID-19 vaccine in elderly patients may not be purely coincidental, but rather the result of an unrecognized chain of vascular stress events. And finally, don't overlook emotional stress from diagnostic tests. Even something as simple as a hearing test or eye exam can raise anxiety levels in seniors who fear bad news or are unfamiliar with the equipment. This emotional stress triggers the release of cortisol and adrenaline, which constrict blood vessels and increase blood pressure. Chronic stress, even from medical appointments, puts an ongoing burden on the cardiovascular system. If that stress is compounded by physical factors like fasting, dehydration, or uncomfortable testing, the brain's blood flow can be affected more than people realize. The problem is not the tests themselves, they're often necessary and can save lives. The problem lies in the preparation, the lack of personalized risk assessment, and the absence of post-test monitoring in vulnerable seniors. So if you or a loved one is scheduled for any routine test, especially over the age of 60, ask questions. Prepare the body properly, stay hydrated, avoid stress where possible, and monitor for symptoms afterward. Because even the most basic medical test can have hidden risks, and in the next section, we'll uncover exactly which one is raising red flags among neurologists and brain doctors across the country. Among all the routine tests that seniors undergo, one test stands out for its surprising link to increased stroke risk. It's not exotic, invasive, or high-tech. In fact, it's one of the most common procedures done in clinics every single day, the blood pressure measurement. At first glance, this seems absurd. How could something so standard, so basic, pose any danger to the brain? But when you dig deeper, the physiology and the science tell a different story. The typical blood pressure test uses an inflatable cuff that tightens around the upper arm, temporarily squeezing the brachial artery to stop blood flow. Then, as the cuff slowly releases pressure, the device detects the return of blood flow and records the systolic and diastolic values. This process seems harmless. But for elderly patients, especially those with stiff arteries, calcified plaque buildup, or fragile vascular walls, the sudden and forceful pressure applied by the cuff can disrupt the very stability of those arteries. When the cuff inflates, it creates a temporary state of ischemia, meaning the blood flow to the lower arm is cut off. This sends a signal to the heart to increase pressure in response. The heart beats harder and faster to overcome the blockage. When the cuff is released, a rush of blood floods the limb. For healthy, elastic arteries, this is no issue. But for aged vessels that have narrowed over time due to atherosclerosis, this sudden surge can cause microscopic cracks in the plaque. These cracks may cause small pieces of plaque or clotting materials to break free and travel through the bloodstream, including up toward the brain. This is not just theoretical. There have been several documented instances in which patients experience transient ischemic attacks, or even strokes, within hours after visiting a doctor's office for a routine checkup. The only notable procedure performed? A blood pressure reading. These cases often go unreported because of the assumption that strokes only occur due to larger, more invasive triggers. But subtle mechanical stresses, especially in compromised arteries, are just as dangerous. Another key issue is white coat hypertension. This refers to the temporary spike in blood pressure that many people, especially seniors, experience when visiting a doctor. The anxiety of being in a medical setting causes the body to release stress hormones like cortisol and adrenaline. These hormones constrict blood vessels, raise heart rate, and elevate blood pressure. Combine this internal stress response with the external pressure from a cuff, and the cardiovascular system is being hit from both directions. This double stress event, emotional and physical, puts vulnerable seniors at a significantly higher risk of vascular injury. In some cases, the body compensates poorly, resulting in uneven blood flow, pressure spikes in the brain, or even small bleeds. And because strokes don't always happen instantly, many of these events are delayed. A senior may return home feeling slightly dizzy or disoriented, go to bed early, and wake up with slurred speech, weakness on one side of the body, or confusion. Often, they don't connect the dots back to the blood pressure test the day before. But the issue doesn't stop at the cuff itself. There's a secondary layer of risk that involves the interpretation of the results. If a high reading is recorded, especially a falsely elevated one due to white coat hypertension, the doctor may immediately prescribe or adjust medication, such as a blood pressure-lowering drug. While the intention is good, the result can sometimes be disastrous. For example, if the patient's baseline blood pressure is actually normal at home, but the reading at the clinic shows 170/100 due to stress, the doctor may prescribe a powerful antihypertensive drug. The patient goes home, takes the medication, and their blood pressure plummets too low. Low blood pressure, also known as hypotension, is a silent threat to the brain. The brain relies on a steady, consistent supply of oxygen-rich blood. If blood pressure drops too low, even briefly, it can cause reduced perfusion to critical brain areas. This can lead to fainting, dizziness, or in some cases, an ischemic stroke. Seniors with already reduced vascular elasticity are the most at risk, especially if they stand up quickly, get out of bed too fast, or take their medications without enough food or hydration. Unfortunately, this domino effect is rarely acknowledged. A simple, routine test leads to an inaccurate reading, which leads to a medication change, which leads to a blood pressure crash, which leads to brain ischemia, all within 24 to 48 hours. By the time symptoms appear, the connection to the original blood pressure reading is often forgotten. This phenomenon is also seen with home blood pressure monitors. Many seniors are told to monitor their own blood pressure at home, which is a good idea in theory. But if the cuff is too tight, the machine is inaccurate, or the reading causes panic, it can backfire. Some patients take multiple readings in a row, trying to get the right number, which means repeatedly inflating the cuff and squeezing the artery. This constant disruption to blood flow may not be dangerous in young people, but for seniors with compromised vessels, it becomes another layer of unnecessary stress. Beyond blood pressure tests, another seemingly innocent procedure that carries risk is the fingerstick blood sugar test. While this test doesn't affect circulation directly, the protocol often involves fasting for several hours. Seniors with diabetes or borderline low blood sugar may experience hypoglycemia, low glucose levels, which deprives the brain of fuel. The brain needs glucose just as much as it needs oxygen. A low sugar state can cause dizziness, blurred vision, confusion, or even seizures. Combine this with dehydration from fasting, and the stroke risk increases further. Then there's the rapid ECG, or electrocardiogram. This test is done to check the heart's rhythm and electrical activity. It's quick and painless. But if done during a stressful moment, or while the patient is lying flat too soon after eating or standing, it can provoke changes in blood flow or pressure. More importantly, if the test shows minor abnormalities, doctors may respond with medications or testing that carries its own set of risks. Again, the problem is not the ECG itself, it's the chain of events that follow, especially in an elderly body already teetering on the edge of vascular balance. All of these examples point to the same unsettling truth: our healthcare system treats routine testing as universally safe, when in fact, for seniors, no test is truly routine. The aging body responds differently. It has less room for error. It cannot bounce back from stress the way a younger body can. What might be a small fluctuation in blood flow for a 30-year-old could be a catastrophic disruption for an 80-year-old. So what's the answer? Awareness, personalization, and preparation. Medical professionals must stop assuming that one-size-fits-all testing protocols are appropriate for elderly patients. Blood pressure cuffs should be used with gentler inflation settings. White coat hypertension should be considered before any medication change. Fasting protocols should be adapted to ensure adequate hydration. Post-test monitoring must be mandatory for patients with a history of stroke, TIA, or cardiovascular disease. And perhaps most importantly, seniors and their caregivers must become advocates. Ask the nurse to use the correct cuff size. Thank you for watching this eye-opening episode on health education. If you've made it this far, you now understand the hidden risks behind a routine test that millions of seniors undergo without a second thought. We've uncovered how something as simple as checking blood pressure or fasting before a test can set off a chain reaction in the body, especially for those over the age of 60. As a brain doctor, it's deeply concerning to see how many strokes could be prevented with just a little more awareness and precaution. The truth is, it's not the test itself that's dangerous, it's the lack of preparation, the absence of proper hydration, and the way the aging body reacts that makes the difference. Remember, your brain is your most valuable asset. If you or a loved one has a medical appointment coming up, ask questions. Stay informed. Monitor how you feel afterward. And never ignore small symptoms like dizziness, fatigue, or confusion. These could be your brain's early warning signs. At Health Education, our mission is to bring life-saving knowledge directly to you, especially topics that are rarely talked about but deeply affect senior health. If you found this video helpful, please like, subscribe, and share it with others. Someone you know may be at risk, and this information could make all the difference. Hit the bell icon so you never miss an update, and drop your experiences or questions in the comments below. We read every comment, and we're here to help you stay safe, strong, and informed. Until next time, take care of your brain, because when you protect your mind, you protect your entire life.